So this is Nacho, an 8-year, 3-month male neutered greyhound who lately has been exhibiting signs of hind end pain and weakness. So today we're going to needle some points that are useful in treating hind limb disorders. We're going to start with Yao Bao Hui or Ba Hui, which is a point on the dorsal midline over the lumbosacral space. So you find the wings of the ilium and run your finger caudally down the dorsal midline, and there will be a depression, and we're going to sedate. So we push in quickly and turn it counterclockwise. This is sometimes easily confused with governing vessel 3, which is the lowest point on the dorsal midline in between any of the dorsal spinous processes. So when I run my finger down here, this point here is low. And so I'm going to put a needle in governing vessel 3 and again sedate it. Governing vessel 3 and Ya Ba Hui have similar actions in that they are useful points for hind end weakness. The next points that we're going to demonstrate are 3 local hip points: gallbladder 30, bladder 54, and gallbladder 29. Bladder 54 is easily found when you locate the greater trochanter and just pop up this way, just dorsally. Right there is bladder 54. So you can use that point after you've found the greater trochanter and you find the ischium. There's a depression between the ischium and bladder 54, and that is gallbladder 30. The hip points form a triangle: gallbladder 30, bladder 54, and gallbladder 29. Usually what I'll do is I'll put my fingers like this, and gallbladder 29 is going to be right here. So those are the 3 local hip points. Another useful point in releasing the hind end is gallbladder 27. And gallbladder 27 I find by running my fingers under the epaxial muscles on the ventral aspect, and right where that hits this muscle, the thigh muscle here, is gallbladder 27. And you can probably appreciate there's a little bit of twitching right there, indicating that this point is active. So we will insert it rapidly and twist it counterclockwise to sedate it. One final point that I'm going to show you for treating the hind end is back down here behind the knee in the center of the popliteal crease, and that's bladder 40. Bladder 40 is the master point for the lower back and hind end. And again, we will sedate it by inserting it rapidly and twisting it counterclockwise. Bladder 40 can be a very useful point in determining your pattern, your TCM pattern. When you sedate bladder 40 and you feel the pulse improve, diminished tone, a more mid-depth pulse quality, then you know that you have an indication for an herbal formula that's called Duho Ji Sheng Tong that treats a spleen deficiency with damp, channel obstruction, liver blood deficiency in combination with kidney deficiency. So those are the points for the hind end that I'm going to show you today on Nacho. Thank you.